And good evening to all of you. Progress amid the pain. While new grim numbers roll in involving hospitalizations and deaths related to COVID-19, we are now arming ourselves against the virus, albeit slowly. 2 vaccines are now being distributed throughout the U.S. and here in our area. This while Congress is on the verge of passing a new stimulus package. But big advances come with big questions. Hence another coronavirus town hall here with Monroe County Executive Adam Bello and Health Commissioner Dr. Michael Mendoza. Thank you both for joining us once again. We are going to start with Dr. Mendoza. First and foremost, you just received the vaccine, I believe, last week. How are you feeling?
Well, thanks for asking, Adam, and thank you again for hosting us this evening. I am feeling fine, thankfully. I received the vaccine on Wednesday morning. I had some arm pain at the site of the injection there for the next 24 hours or so, but by the next Thursday evening, I was feeling totally normal.
Excellent. And back to Dr. Mendoza real quick. You just heard Maureen talk about this new strain over in the UK, possible new strain. There's a lot of questions about that. Ellen Lippa, a viewer, emailed in wondering what your take was on that and whether we should be blocking off travel from the UK right now.
Well, this is obviously an area of intense interest right now. We are just now learning about this. There's still so much more that we have to learn. This is very reminiscent of where we were this past spring, when we weren't exactly sure if the coronavirus was here in the United States or not. I think my intuition tells me that there's a fair chance that it's already here in the United States. But we are learning a lot more, and one of the questions that has come up is what do we believe in terms of the vaccines that are out and whether they will protect against these new strains. And we are learning a lot more, but the current assumption is that the current vaccines will protect against this strain, but there's a lot more we're trying to learn. At the end of the day, we want to make sure everybody understands that we need to continue with all of our precautions, because until we have that level of herd immunity from the vaccine, these precautions like masking and distancing and so forth are going to be our most important line of defense.
Dr. Mendoza, thank you. We're going to get back to vaccines and treatment and all of that, but I want to get to the other big issue that's coming out today. We've got the stimulus package, and as far as relief for our area, County Executive Adam Bello, I know a lot of municipalities like Monroe County, like our towns and villages, wondering if they're going to get any help in this. What are you seeing so far?
Well, as far as state and local governments are concerned, this is not exactly what we were hoping for in terms of direct aid to state, local, and county governments. But there is still a lot of good things that is in this legislation here that we're looking forward to. One of the challenges that we're facing as a county, and I know a lot of our towns in the city of Rochester are facing as well, is revenue shortfalls, particularly around sales tax revenues, hotel-motel tax revenues, which are impacting the state government as well. And those revenue impacts ultimately could lead to looming state aid cuts, which would really be problematic for county governments in particular, because we are that level of government that provides that service to people who are most negatively impacted by the spread of COVID-19 in the community. So we view this as a good first step. And, but hopefully with the new administration coming in next month, there's opportunities to do more. But in this particular legislation, there is still a lot of good. I'm pleased that there's $82 billion for schools to help support our public school systems throughout the country. There's an increase in SNAP funding that would increase the benefits by 10% to help with food availability to those that are struggling. There's additional dollars for child daycare to help make that more affordable as well. And there was also the enhanced federal unemployment insurance that's going to add $300 a week to those who are unemployed. And my understanding is there's an additional over $300 billion into another round of PPP funding as well. So there's a lot of good support in here, I think, for individuals, for small businesses that I'm particularly concerned about. So this is some much needed relief to people at home. And from what we understand, hopefully they're negotiating another package early next year as well.
Yeah, a follow-up to that, County Executive Bello. Yeah. I've heard from friends who are in the performing arts arena or the restaurant industry. A lot of them are telling me, I got a couple months left before I go belly up here. What is your answer? I'm guessing you're getting a lot of that feedback as well.
Oh, we're getting a lot of that. And that's probably one of my top concerns next to public health and the health of our community is the economic impact on small businesses, particularly restaurants that are being, I think, hardest hit right now because of the restrictions, particularly in the orange zone. And we've done, through Monroe County, our small business grant program that we rolled out in the last month and a half. We've offered PPE to help small businesses, but without additional support from the state and federal governments, this is going to be very difficult, particularly now, too, while we enter into the winter months, where, gathering indoors, you can't really do outdoor dining anymore, so gathering indoors, being very close to people in these tight environments is really not, is something that people are comfortable doing, and also with the reduced capacity, you really can't do it the way we used to. So we do need additional support, particularly I think the PPP loans are a good step. There's also, things that we could do on a local level as well. Just last month, legislation was introduced into the county legislature that would reduce the fee that these third-party delivery companies charge restaurants, particularly small business restaurants here. We're talking about those third-party deliveries like the Grubhubs and the DoorDashes of the world and Uber Eats. They charge restaurants for that service, and it cuts into the profit margins. And I think that, the legislation that was introduced that would reduce the percentage that they charge those restaurants would save restaurants much-needed resources so that they can continue to stay open. And I hope the county legislature raises that from the table and passes that legislation as soon as possible.
County Executive Bello, thank you. When we come back, I'm going to ask Dr. Mendoza who's being vaccinated now and who's next. Stay with us. Welcome back to our Coronavirus Facts First Town Hall. This question going to Dr. Michael Mendoza. Dr. Mendoza, this question is rather simple, at least asking it, but its distribution has been extraordinarily mammoth in scale. Who has been vaccinated so far in our community?
Well, let's just step back and remember that this is probably going to be the most substantial public health undertaking of our generation. At no point really in recent history have we had the responsibility of needing to vaccinate so many people in such a short period of time. And right now we are in the very earliest stages of this vaccine distribution program. The intention of the first week or two was to administer this shot in hospitals and in healthcare settings so that we can manage any unintended consequences that might arise. Thankfully, we have not seen very many of those at all. But for right now, we are administering the shot to healthcare workers who have a higher chance of encountering people who have COVID, who see people with COVID in a healthcare setting, and shortly followed by EMS and other first responders, as well as residents of long-term care and the people who work there. Now, the main limiting factor right now is that we don't have enough lines to get people into to get the shot. And so we're working very hard as we speak to develop more points of dispensing so that we can get more people the shot as efficiently as possible.
And Dr. Mendoza, I'm sure you've seen, like we have out in the community, frustration over how the vaccine is being allocated. Some people saying they should be first in line or trying to move up in line. What's your response to that frustration?
I get it. This is pent-up demand that we've been waiting for months now, and I completely understand, because nobody is intending to devalue the contributions that one person has in terms of our overall healthcare response versus the other. But the reality is that when you have a line and you have limited supply like we have right now, there is going to be a wait, and we will continue to see this as subsequent phases roll out. You know, there are going to be people who are, quote, ahead of you in line, who you might perceive have a lower risk than you, which is why it's so important that we're trying to develop as many points of dispensing in the community as possible so that we can try to shorten that wait for as many people as we possibly can.
Very good. The next question is from Monroe County Executive Adam Bello, and this one comes from a viewer, Carrie, who asks this. With our rates increasing in Monroe County, why don't we have more free rapid COVID testing sites in the suburbs in Monroe County?
So, Carrie, that's a great question. It really simply comes down to the resources that we have. It's a resource issue. So it's about bodies, because it takes an awful lot of people to run these sites to do them well and make sure they're safe. And then it also comes down to how many test kits that we have that have come from New York State for us to be able to put out into the community. So what we did was, understanding we were starting in the orange, we went into some orange zones a few weeks ago. We decided to start there with the orange zones, where we knew there was the greatest concentration of positive cases and where the positivity rate was the highest, and set up rapid testing sites that operate almost every day of the week. So we've built them out. We started with one site and then just kept building and building and building them out. They're open nearly every day. Pre-registration is suggested, but walk-ups are welcome. And we do have some limited numbers that we can do as walk-ups. The teams are doing their very best not to turn anybody away. And then what we've also been able to do as we build that capacity is to work with other groups to try to, when there's a change in the condition that requires rapid testing, for instance, when the barbershops and salon owners were given notice that they could reopen, particularly in the orange zone, but again, they had to have that test before they opened. We opened up a whole new testing site just to get them open and get everybody through. So we'll continue to do that. We're working to do that, but it's really at this point a resource issue, and as much support as we can get, again, from the state and federal governments to continue to expand that, we'll continue to do so.
I want to squeeze in one more question here before we go. So, Dr. Mendoza, this question is for you. It's from Z. Can you address the possible connection between the vaccine and potential allergic reactions? So, again, this question is going to Monroe County Health Commissioner Dr. Michael Mendoza.
So just to step back again, this vaccine has been studied for its short-term effects very, very extensively through very rigorous studies. Even though we've seen a very accelerated timeline for this, none of those short-term effects have been, there have been no steps that were skipped in that entire process. So in terms of the issue of allergic reactions, what we're seeing with this vaccine is the same concern that we see with other vaccines. Anybody who has a history of an allergic reaction to any of the components of this vaccine should think twice before getting the vaccine. The CDC has said it is not an absolute contraindication, but people should be aware and should make sure that they're getting the shot in a location that might be prepared to handle any adverse reactions. But again, to reiterate, no corners have been cut with regard to looking at the short-term safety of this vaccine.
All right, Dr. Mendoza, thank you. So let's say that because of your age or your occupation, you're next in line to get the vaccine. How will you be notified? We're going to ask that very question to County Executive Bello when we come back. Our Coronavirus Facts First Town Hall continues now. The next question is going to Monroe County Executive Adam Bello. Mr. Bello, this question is from Marie, who asks, how will those of us who have health issues and are over the age of 75 be notified when it is our turn to receive the vaccine? And I'm going to expand upon that. How will any of us know when our group comes up?
Right, so that's a really great question. And so as we talk about a lot, and you see on TV, the vaccine right now, because it's in limited supply, is being distributed in phases. The first phases were healthcare workers, long-term care facility workers and residents, first responders, then come next teachers, and so it's going down into categories and phases. The governor has designated local hubs across the state. There's 10 hubs, including here in the Finger Lakes area, here in Monroe County. It's a Strong Memorial Hospital. And the hub his responsibility is to try to build out each one of those phases in the distribution model. So certainly what the goal is for each one of those is, particularly when we get down to the general public, people over a certain age bracket, things like that, is to work with your primary care physician and go through the same process you would normally go through to get a vaccine through your doctor so that we don't really have to go back through and reinvent the wheel. But I don't want to guarantee that quite yet because those phases are still being built out, and of course it all depends on the quantity of the vaccine that comes in and when it comes in. But we wouldn't want to see this all get reinvented from scratch, and my expectation would be you'd work with your primary care physician when we get to that stage.
Very good, Mr. Bello. Thank you. Next question is for Monroe County Health Commissioner Dr. Michael Mendoza. Dr. Mendoza, a viewer emailed us in the newsroom today reminding us that before we were talking about the vaccine, all the talk was about treatment. My question is, how has that been going so far? Are the treatments what you had hoped for? And if so, how's the supply and the equipment and all that?
Well, as this pandemic has rolled forward, we have seen so many potential treatments come and go. But at the end of the day, what we're seeing locally is that we're doing a much better job treating people who end up getting COVID-19. We know that because the length of stay in the hospital is shorter. We know that because we are identifying people who have COVID-19 earlier in their course of illness. We're able to prevent many people from even needing to go to the hospital. So, we're doing a better job overall. But the reality is, it's not perfect, and we know this because we are losing far too many people to COVID-19 here in Monroe County every day. So we still want to emphasize prevention, but I will say that we will continue to follow the science, and as new treatments come on board, we'll evaluate them as rigorously as possible. Some of the monoclonal antibody treatments here, for example, were studied in trials at our local hospitals, and turns out the evidence isn't great for their use, and so neither of our hospitals is using this. But we will continue to follow the science, and as emerging treatments come out, we'll evaluate them rigorously.
So no silver bullet at this point once someone is infected and their symptoms worsen?
No, we do know that steroids and remdesivir and antiviral treatment have probably shown the most promise, but there is no silver bullet on this one, unfortunately.
Dr. Mendoza, thank you. On a related note, I want to talk about our hospitals in the area. So, County Executive Adam Bello, this question is for you. What does capacity look like in our hospitals? And I'm asking this, it's kind of a two-parter because we might move into a red zone if capacity reaches a certain level, according to Governor Cuomo.
That's correct. And right now, we have about 30% of the capacity is still remaining in our hospital systems. And a red zone is defined as your hospital capacity reaching 90% full, which means you only have 10% left, within a 3-week period of time. So you do your projections out, and if you're projected to hit 90%, that's when it would trigger a red zone. Right now we're at 70%. So how the systems have been handling this, and we talk to them on a daily basis, is they load balance within their systems. And they do so by looking inside the hospital to ensure that as the COVID positive admissions start to increase, that what they do is they then pull back on the elective surgeries and other types of admissions so that it balances out, so that that capacity still remains and they still have that ability to surge if necessary. So even though the percentage of COVID positive patients that are in the hospital right now continues to go up as a percentage of all those hospitalized, that's why you still have not seen a real stark increase in the number in the number of people hospitalized, because they've been pulling back in the other areas. So they've been able to balance that inside. Now that's a good situation to be in today, because they're managing that capacity. It's not overwhelming the hospitals yet, but that's not a real good long-term solution to this if the numbers continue to go up, because what will happen is those elective surgeries, it sounds like the term makes it sound like it's something that's unnecessary, but it's necessary. It is necessary to the people who are waiting to receive those procedures. They're just not procedures that are needed today. They're not emergencies, but they are quality of life procedures and medical procedures that are deemed necessary, that are getting pushed off into the future. So that's why we as a community, even though we're not seeing that 90% full yet, and we're really not on track to see that in the coming weeks, we still have to come together and understand that there is still a strain on the healthcare system. There's a strain on patients in the community and on our healthcare workers, and we all have to work together to flatten the curve to support those in the hospital systems, because they're the ones that are treating our families, not just for COVID, but for all the other ailments that are afflicting us as well.
Mr. Bello, thank you. And flattening that curve has a lot to do with Christmas. And Dr. Mendoza has a message about that in just a moment.